Okay, our next witness is Maureen Sheridan. And do you swear or affirm that the testimony you're about to give is true?
Yes.
Thank you. And state your name and go ahead.
My name is Maureen Sheridan now. I was born Beth Lyons at St. John's Hospital in Queens in early January in the mid-1970s and was adopted through the Catholic Home Bureau several months later. I spent the months in between in the New York City foster care system. I've been told through the years that I was a good baby because I never cried, and I used to think that was a compliment. Now, as someone who works and studies in a mental health related field, I wonder what happened in those months from the separation from my birth mother through being matched with my adoptive parents that taught me, when I was that little tiny infant, that crying was of no use. I always knew that I was adopted through a closed adoption, just like everyone else I knew who was my age and adopted. I didn't start to look into my adoption history until I was in college, mostly because I assumed there was nothing I'd be able to learn and because I didn't want to hurt my adoptive parents. I started looking for information when, within several months, 2 different medical professionals told me it might be important for me to learn about my medical history. Once when they suspected I might be diabetic, and the other when I had a suspicious mole removed and biopsied. Both times I had been asked about that history and had to reply, "I'm adopted, I don't know." I then went on to receive my non-identifying information for the first time, almost 20 years ago now, and learned some of my birth family's medical history, that is through 1975. The information that was there was minimal. My birth mother, after all, was young then. The only thing I learned about her health was that she had had extensive dental surgery when she was 16. I also learned that they were poor, that her father was extremely hot-tempered and abusive, and that she was convinced to give me up by her mother and her sister so they could keep the pregnancy from him. My biological father did not know I existed at the time of my birth. So after I finished my first graduate school program and was working at a university in Pennsylvania, I made 4 separate trips to the New York Public Library, painstakingly combing through the birth book for my year, which is how I came to find out that my birth mother had named me. This was the first time it had really struck me that she hadn't just given me away or abandoned me. She had cared enough to give me a name. Unfortunately, that's about as far as I've gotten in finding out much more about my original identity, my birth family, or their medical history, my medical history. I haven't stopped trying to find out more. I lost $1,800 I couldn't afford during that job that paid me $24,000 a year out of grad school to a predatory private investigator that had promised me everything and gave me nothing in my search for answers and kept asking for more money. That's what happens sometimes with private investigators. I have traveled out to the library in Queens and taken time off from my job now, which is busy as the Director of Student Support and Crisis Management at my current university, to look up obituaries on microfiche, going through them day by day, month by month, to look for others with my original last name. I have spent hours on Ancestry.com, armed with the little information I do have, and while I've made some potential progress, I still don't have any solid leads. I once tried to request my birth certificate under my birth name, thinking it was worth a chance. Of course, I was told I wasn't entitled to that information. I am not entitled to my own birth certificate. Like so many others, my adoption records burned in a fire in the mid-90s, the Catholic Home Bureau. The hospital I was born in has since closed. The lawyer that handled the adoption has retired and doesn't seem to have retained any records. My adoptive parents, now completely supportive, have requested them and received nothing. The records that are, I was adopted in Suffolk County, the county of that great judge that spoke before, the county is not known for letting you go through their court process. Sometimes it almost feels like I don't exist. I will keep looking though, and one day I will find what I'm looking for. I just hope that I find a person, preferably my birth mother, who can tell me the rest of our story, and not a grave to visit like so many others. If she wants contact, that is. If she doesn't, it would be difficult, but I would understand as long as I could get more extensive, updated, past 1975 medical information. It shouldn't be this hard. Why is it this hard? And now it's not just about me anymore. It is also about my children. When my daughter was born, I didn't expect to become so overwhelmed to meet somebody, to hold somebody who is biologically related to me. I had never seen someone who shared my features, somebody I could look at and see myself reflected back, even in the smallest of ways. It was by far the best, most amazing, awe-inspiring moment of my life. So after she, the first person I ever met who shared my blood, my child who I felt this overpowering, all-encompassing love for, died suddenly in infancy, I was asked once more, and I hardly ever do cry, really, asked once more for my medical history and whether we had a history of sudden death in our families. My husband was able to say no. I had to say once again I was adopted. I don't know. I couldn't even give her that. I've gone on now to have 2 sons. When Liam, my first, was 6 months old, my husband walked into daycare to the paramedics rushing in. It was Liam. They said he had stopped breathing. He started breathing again on his own. We were cautioned to take him to the hospital just in case. We spent the next several days, 6 actually, at Cornell, watching them attach electrodes to his head. Since he was 6 months old, they had to attach the full adult amount of electrodes. Stick needles in his heel and monitor his heart. He was a breath holder from when he was 2 months old when he got upset. So to this day, we're not really sure what happened that day, whether he was crying, they didn't pay attention to him, and he passed out. And the test results were ambiguous. So he could have just been crying to the point of holding his breath. To be on the safe side, he had a Holter monitor, took medication to keep his heart beating at a certain rate, and had a pediatric cardiologist until he was 1. He is a healthy, almost 5-year-old boy now. But back then, over and over again, to the rounds on the papers, to every different doctor we talked to, I had to say, I'm sorry, I don't know, I was adopted. When our second son, Elliot, was born, they had detected what they thought might be an abnormality that indicated long QT syndrome. Long QT syndrome causes 3,000 to 4,000 sudden deaths in children and young adults each year. It is also very underdiagnosed because it can't be tested for after death. Additionally, you are at increased risk if anyone in your family has ever had it, which is why it's really important to know if you have a history of sudden death in your family. And there I was at another doctor's office enduring another harrowing wait, this time with a 4-week-old infant. We are incredibly relieved to find out he didn't actually appear to have it after all. And Elliot is now a happy, rambunctious 3-year-old. But in the meantime, while I was waiting to find out, I said it to him this time too. I'm sorry, Elliot, I'm adopted, I don't know. We would like to have one more child, but I'm getting close to 40 now, and I'm not sure that I really want to do it without knowing more about my medical history. Unsealing my birth certificate lead me to finding out answers that could help us make a more informed decision. I don't want to have to say to another child that I'm sorry, I don't know, I'm adopted. Taken from the American Medical Association's website. Gathering a complete and accurate family medical history is extremely important, as genetic medicine explains more diseases. In fact, the Surgeon General has named Thanksgiving as Family History Day. Since several family members gather on Thanksgiving Day, it is a great opportunity to talk to family members and learn more about their history. Other medical organizations and associations also have statements about the importance of family history. But what about those of us who sit around the Thanksgiving table with a family that we love very much, but who can't tell us anything about our own health histories? When can I stop feeling somehow responsible for failing my children because I can't fill out that section on the medical questionnaire or provide answers during medical rounds when my child is in a hospital bed? When will adoptees be able to access their own biological health histories just like everybody else? Unsealing birth certificates would be a step in that direction. And yes, access to health information is my biggest motivation in speaking to you today. But there is also another very important reason too. Before my adoption was finalized, my birth mother went to court in Suffolk County to try and get me back. When I first heard that story, I actually was under the impression it was after it was finalized. I just learned several months ago that wasn't true. I felt sorry, I felt terrible for my adoptive parents, how terrifying that must have been for them. But I now really feel horrible for that young girl who had no access to resources, who made her way to that court out in Suffolk County to try to get custody of me back. My parents' lawyer told them not to worry, he would take care of it. The case never made it out of that judge's chambers, and my parents were just told that it was no longer an issue. Who know what the lawyer, the social worker who was working with my parents and very supportive of them being my parents, and the judge said to that young girl to get her to drop the case. I would like to know if she'd like to tell me. I just have to find her first. I've heard that 95% of birth mothers are happy to be reunited with their children that they have lost to adoption. Most of them were not promised confidentiality, as you've heard from others today. So much is told to contact, or not to contact or look for those children because it would harm their children. Many were coerced into giving their children up. So who is this law protecting? Not that 95%, not adoptees, not the parents of adult adoptees. Is it that very small minority that the law allegedly protects worth the damage it does to the rest of us? Martin Luther King Jr. said that an unjust law is a code that a numerical or power majority compels a minority group to obey, but does not make binding on itself. This is difference made legal. You have the power to change this unjust law and allow adoptees the same rights as everyone else. Will you?
What hospital were you born in?
St. John's Hospital in Queens.
I was born there also. It's been closed for about 6 years now.
Yeah, I actually tried to, I looked at their storage facility and actually made a request with my birth name and the days that I assumed I would have been in the hospital to see if any of the records came up, but they said they had no record of me either.
I'm a Catholic Home Bureau baby as well, so but I was born upstate. Also, the hospital had closed, so there's nothing there.
Yes, and then the fire happened after I got my non-identifying information the first time, so they can't get it anymore. All the adoption records were lost. I got it again recently this past year, and it was actually different than the first non-identifying information I got, so I'm not sure what's right.
And as long as we're sharing, I was born in French Hospital on West 29th Street, and it has been an apartment building since about when you were born.
Thank you.
Thank you.
For coming.
Okay.